Foundation Module 3 UHS Modular Integrated Undergraduate Curriculum Physiology Dr. Sheen CEO and Founder Sheikh Zayed Medical College Physiology Department. Medical Superfast Simplified Physiology Video Lecture Notes. Guyton and Hall 14 edition chapter number 5 lecture number 9 page 65, 66, 67. Describe the physiological basis of generation of RMP. RMP equals when the cell is not stimulated, the difference in potential is called the RMP. Or when it is not transfer nerve signals is called RMP. Value minus 90 millivolt. The RMP of large nerve fibers when they are not transmitting nerve signals is about minus 70 millivolts. It is primarily established and maintained by the distribution of ions across the cell membrane and the selective permeability of the membrane to different ions. The transport properties of the resting nerve membrane for sodium and potassium and the factors that determine the level of this resting potential are explained. Active transport of sodium and potassium ions through the membrane, the sodium-potassium pump. All cell membranes of the body have a powerful pump, a pump that continually transports sodium ions to the outside of the cell and potassium ions to the inside. This is an electrogenic pump, leaving a net deficit of positive ions on the inside and causing a negative potential inside the cell membrane. The sodium-potassium pump also causes large concentration gradients for sodium and potassium across the resting nerve membrane. These differences are as follows. Sodium outside 142 milliequivalent per liter. Sodium inside 14 milliequivalent per liter. Potassium outside 4 milliequivalent per liter. Potassium inside 140 milliequivalent per liter. The ratios of these two respective ions from the inside to the outside are as follows. Sodium inside / sodium outside equals 0.1. Potassium inside / potassium outside equals 35.02. Leakage of potassium through the nerve cell membrane. There is a channel protein, sometimes called a tandem pore domain, potassium channel, or potassium leak channel, in the nerve membrane through which potassium ions can leak, even in a resting cell. These K+ leak channels may also leak sodium ions slightly but are more permeable to potassium than to sodium, normally 100 times are more permeable. Generation, or origin, of the normal RMP. The important factors which develops normal resting membrane potential, they are as follows. Contribution of the potassium diffusion potential. Suppose that the only diffusion of potassium ions through the membrane by open channels inside and outside the membrane. High ratio of potassium ions inside to outside, 35:1. The Nernst potential corresponding to this ratio is minus 90 millivolts because the logarithm of 35 is 1.54, and this, multiplied by minus 61, is minus 94 millivolts. Therefore, if potassium ions were the only factor causing the resting potential inside the fiber would be equal to minus 90 millivolts. 2. Contribution of sodium diffusion through the nerve membrane. Minute diffusion of sodium ions through potassium. Sodium leak channels inside the nerve membrane. The ratio of sodium ions from inside to outside the membrane is 0.1, which gives a calculated Nernst potential for the inside of the membrane of plus 61 millivolts. But the Nernst potential for potassium diffusion is minus 94 millivolts. This can be answered by using the Goldman equation. If the membrane is highly permeable to potassium but only slightly permeable to sodium, the diffusion of potassium contributes far more to the membrane potential than the diffusion of sodium. In the normal nerve fiber, the permeability of the membrane to potassium is about 100 times as great as its permeability to sodium. Using this value in the Goldman equation, and considering only sodium and potassium gives a potential inside the membrane of 86 millivolts, which is near the potassium potential. 3. Contribution of the sodium-potassium pump. The sodium-potassium pump provide an additional contribution to the resting potential. There is continuous pumping of 3 sodium ions to the outside for each 2 potassium ions pumped to the inside of the membrane. There is a continual loss of positive charges from inside the membrane, creating an additional degree of negativity, about 4 millivolts additional, on the inside. Therefore, the net membrane potential when all these factors operative at the same time is about 90 millivolts. Chloride also contributes to the RMP, but its effect is secondary to that of potassium and sodium. In summary, the diffusion potentials alone caused by potassium and sodium diffusion would give a membrane potential of about 86 millivolts, with all of this determined by potassium diffusion. An additional 4 millivolts is then contributed to the membrane potential by the continuously acting electrogenic sodium-potassium pump. Note: keep in mind, the RMP is a result of the combined effects of ion concentration gradients, selective permeability of the cell membrane to different ions, and the action of the sodium-potassium ATPASE pump.